Our last speaker this morning is she'll take us on a journey from healthcare wearables to AI coaching, showing us how innovation is shaping the future of physical activity and mental health. Our next speaker is Professor Carol Maher, a fellow mom of 3 boys from Southern Australia. And she'll share her findings from her team's groundbreaking research alongside international evidence. Her research explores the evolution of digital health tools from early wearables to today's AI-powered health coaches. And Professor Maurer and her team have developed an AI virtual health coach recently that delivers lifestyle coaching designed to mirror human telephone counseling. So please welcome Professor Carol Maurer. Thank you, Money.
Okay. Thank you, Terry, and thank you very much to Dr. Korkor for inviting me to be here today and be a part of this. It's a great honour. So, yes, I'm trying to cover quite a lot of ground in this presentation, and it was a little bit hard to know what to include, but I've given it a go here. So, first of all, I thought I might share with you where I'm from because I find as soon as I leave Australia, no one has ever heard of Adelaide. So Adelaide is actually quite a big city. It's about 1.5 million people. Down there in the is that down there in the bottom of Australia? It's actually the only city in the world where the central business district is completely surrounded by parklands, which was how it was originally laid out when it was planned in the 1830s. It has lots of beautiful beaches. And these are perhaps some of our most famous exports. So Sia is from Adelaide. Any wine buffs here might know of Penfolds Grange, which I think might be Australia's most famous wine. It costs a few $1,000s, so I haven't actually ever tasted it. One day, maybe. And also, it's the birthplace of Australia's first female Prime Minister, Julia Gillard. So I'm from the University of South Australia, which is actually soon to become Adelaide University because two of the largest universities in our state are about to merge, which is pretty huge. So thanks to that, I can now claim this beautiful university as mine. Whereas I actually come from the modern university, which tends to have grey concrete brick buildings. So, yeah, I've been invited today to speak to you about our digital health research, which is a sort of a program of research that's evolved over quite a long time now. So it began back in about 2007. My background is as a physical therapist, and I did a PhD around the time when we were just starting to understand that exercise was actually not harmful for people with cerebral palsy. That's what we got taught when I went through university. And, we were just beginning to understand that exercise, of course, actually holds many benefits for people with cerebral palsy. And that was the group that I worked with as a physical therapist. But because exercise at that point sort of had no role in conventional therapy for that group, delivering a program via the internet was kind of the most viable way of actually being able to, offer that kind of service. So my PhD focused on delivering and evaluating an internet-based program for children and adolescents with cerebral palsy. It was called Get Set, and I searched, but there is no trace of it on the internet anymore. So I have no screenshot of that program. But I could find some of our other early work. So we also did some work a few years after that on Facebook apps. So that's another relic. Facebook no longer supports apps. But so sort of around 2012, I was really interested in can we, harness the power of online social networking to support people to become more physically active? We also did some of the really early work looking at how valid consumer wearables were, how accurate they are. So again, some of these things are long gone. The Nike Fuel Band has, become obsolete. The purple one there is one of the early Fitbit models, also long superseded. Yeah, so this really is a fast evolving space. We've developed various mobile phone apps. We've developed some software that allowed us to harness Fitbit data, which was pretty cool because we can actually get minute level data from users. And, once they give us one-off permission, there's like no participant burden for them to share their data with us. So we were able to do a study where we tracked hundreds of Australians over a whole year and looked at their minute level physical activity, sleep, daily weight gain, mood, and so on. We did a study a few years ago using an AI health coach, and it was sort of off the back of that work that we are now developing a generative AI health coach that I'll talk about a bit later. And then more recently, I get quite a lot of different organisations have been reaching out to us to team up to evaluate their products. So things like Gather My Crew. I don't know that that's made it to the US, but in Australia, that's got a very large number of users. That's around people going through particularly cancer care can use this app to basically share with their family and friends what help they need. And it kind of can help them assemble support. There's a 15-minute workplace challenge, the 15-minute challenge. And also we evaluated a state-based app for parents of children aged 0 to 5 called the Early Years South Australia app. But of course, this is a rapidly evolving space. So I'm going to try to focus on kind of the bigger picture stuff in today's presentation. So obviously digital health has a lot of benefits that we all know of. It's available anytime, regardless of geography. It's really cheap to roll out to a large number of people. And I think like one of the greatest assets of it, in the space that we're talking about today, is that it does offer us a way of giving support to people that's for something that's not sort of traditionally funded. When it comes to, exercise support and mental health, that doesn't tend to be a part of conventional treatment. And, it's really hard to get the health system to fund it at scale. So, digital health has great potential in this area. So, in my presentation today, we're interested in bringing together a few different areas that are really, really well understood. So we know that there is a really strong link between physical activity and improved mental health. There are lots of digital mental health tools, but typically they don't involve physical activity. And there are lots of physical activity digital health tools, but it's this intersection that is the gap. So, yeah, when I was sort of trying to think about how to conceptualize today's talk, it kind of reminded me of a bridge. Now, does anyone here recognize this bridge? Yes, yes. So it's the Hone Bridge in Milwaukee. Yeah, so I'm going to use that as a bit of a framework for today's presentation. So with the bridge, it's made up of some different parts. So first of all, there are the foundations. So we have fantastic foundations in this space with digital health, physical activity tools, and digital health, mental health tools. So I'm just going to start with kind of overviewing the research in this space. Now, it's a huge body of evidence. So I've decided to focus on some umbrella reviews. Now, these are meta reviews. So this is where researchers do systematic review of systematic reviews to bring together, a huge volume of evidence and try to draw out the key messages. So the first review I'm going to talk about is an umbrella review of the effectiveness of wearables for increasing physical activity. And this was done by a postdoc, Ty Ferguson, in our team. And also, we then followed that up with another umbrella review of all other e-health tools apart from wearables. And this one was done by our postdoc, Ben Singh. And actually, thank you, Art, for, I don't know if you noticed that you highlighted one of Ben's other umbrella reviews in your talk on cognition and mental health. Yeah. Okay, so if we do a little side by side of them, one's on wearables, all types of wearables, and the other's on all other leading e-health approaches. So that includes things like apps, web-based programs, and also, programs targeting, physical activity alongside, often it's also alongside other types of lifestyle approaches. So I think you can see here, so both of them kind of picked up in the vicinity of 40 systematic reviews, which together picked up in the vicinity of 500 original randomized control trials and hundreds of thousands of participants. So basically these reviews are huge and we can feel pretty confident in the findings that come through from these reviews. So what effect do these tools have on physical activity? Well, you can see that, oh no, I'm giving it away. Okay, so steps. They both increase steps by, roughly 1,500 steps a day. Wearables tend to increase it a little bit more than the other digital health tools. They both are increasing moderate to vigorous physical activity. So that's the physical activity that makes you huff and puff and tends to have stronger physical health benefits. They both increase that by kind of 6 to 8 minutes a day. Now, that sounds tiny, but actually that is a meaningful change. That does lead to quite important health gains. And then they both increase walking time, but the wearables increase walking time a lot more than the other digital health approaches, which is not surprising because obviously the wearables, we tend to be quite focused on step counts. Okay, and how long do the benefits last for? So we can see that all of these tools do have lasting health effects, although wearables appear to last, the effects last longer. The evidence for this isn't quite as strong because a lot of the studies aren't particularly long-term. But so with the wearables, you can still see a significant increase in activity 4 years later after people first start using a wearable. And then another really nice thing with the meta review is that you can do a lot of different subgroup analyses to dig down and say, okay, does it work better for certain types of people or, certain types of physical activity and so on. And basically, the overall finding is these tools pretty much work for everyone. And when it comes to the different e-health approaches, all of them work. The apps work, websites work, wearables work. I probably don't need to repeat this because I've just gone through it. But I guess maybe this last point is an important one. So overall, they're both increasing physical activity, But wearables are probably particularly good for increasing physical activity, steps, light physical activity, whereas the other approaches like apps and websites tend to be good for capturing that or for intervening on the other health behaviors. You know, if you're wanting to intervene on both physical activity and sleep or, and nutrition. Or I guess if you're, wanting to deliver other educational content in addition to just changing the behavior. So that really suggests that together, they work really nicely. Okay, so next, if we look at that other foundation, digital tools for mental health, there's a huge number of tools out there. These are some of the really common examples, although Woebot has recently been discontinued. And they usually use cognitive approaches and particularly cognitive behavioural therapy. Now, this is another umbrella review, not our group's, but it's a nice recent one. I think it came out in 2024. Can't actually read that. Yes, 2024. Okay, so and they showed us that, when you look at all these tools together, yes, they make a difference for depression, anxiety, and stress. But as Art went soon to in his presentation, in these types of studies, it is really important. Well, it's better if the studies use some sort of active control rather than just a no intervention control, because with these outcomes, just kind of enrolling in a study and having someone, wanting to track you in itself is a bit of an intervention. So if we dig into it a bit more, sort of those higher quality studies that used an active intervention would suggest that these digital health tools tend to have a kind of small but beneficial impact on depression, stress, and anxiety. And also the tools that used a cognitive behavioural therapy approach were significantly more effective than the other approaches. Okay, so we have great physical activity tools, we have great digital mental health tools, but those tools don't tend to use physical activity. So next, let's have a look at the evidence that is connecting those two foundations. So looking at that intersection point. Okay, so another postdoc in our group, Jacinta Brinsley, has just earlier this year published this systematic review on physical activity, mental health, digital tools. So I think the first thing you'll notice here is it's a heck of a lot, the evidence base is a heck of a lot smaller. So around 60 trials have been done in this space and, just around 20,000 participants in total. So it's a much more fledgling research area. But we do see that the interventions do have a beneficial impact on depression, anxiety, and stress, particularly depression. And when we dig into those results, when it comes to physical activity interventions, we don't tend to find that it makes a difference whether you have an active control or just a no intervention control. So that tends to be different to the sort of more cognitive approaches. When we looked at, so this actually looked at physical activity and other lifestyle interventions, so sleep and nutrition or a combination of all three. And it showed that the studies that used physical activity, sleep or multi-behaviours all tended to get similar levels of benefit, whereas the diet interventions didn't have a significant benefit. And when we looked at whether there were particular types of e-health delivery that worked better, generally we found that all of them worked pretty well, but there was a trend for chatbots to work better. And also, the more recent studies tended to be more effective. So I guess that's encouraging. We're getting better at this. And probably, our approaches are getting more sophisticated, both because we're, learning from what's come before us and also because technology is improving and, we can do more. So this is a study that we're in the middle of right now, which is using generative AI technology to deliver a virtual health coaching program. It's called Live Better SA because I'm from the state of South Australia, which we call SA. And this project we're doing in partnership with our state health department. So for about the last 10 years, our state and actually most states around Australia offer a free telephone coaching lifestyle program, primarily aimed at supporting people to lose weight. But people can also sign up for it for, stress and, other chronic diseases. So, and that program has been well evaluated and, gets reasonably good effects. People tend to lose a little bit of weight and get good benefit from it. But the major problem with it is it's really expensive because it's one-on-one coaching, even though it's over the telephone. There's people are still having one-on-one phone calls, and so it actually costs around $1,000 per person that the government puts through this service. And so that really limits how many people can get access to it. So with this, the whole idea behind this is, well, can we use AI to produce, I'll just run this actually, a video in the background. Oh, this is a video. I don't know if you can make it play. There should be a little play button there somewhere. You can just watch this while I'm talking. It's the conversation of someone being onboarded into the program. There we go. So we're trying to replicate that experience of having one-on-one coaching where it's really personalized to someone's situation. So there's this onboarding question, which is a bit like when a health professional is interviewing someone for the first time to kind of understand where they're starting from. And then that will go into a motivational interviewing goal setting component. And then people can come back and check in with the program and get personalized advice and, set their new goals. So we're near the end of software development for this. We're undergoing lots of beta testing, so trying to get the program working really, really well because we really wanted to give people a positive user experience. And we're hoping to start a major trial of it by the end of this year. So we will be doing and it's called a non-inferiority randomized controlled trial, where we'll be comparing people going through this program to people going through a telephone coaching program. And we're hoping that we can get a similar level of effectiveness from the digital program, but it's far, far cheaper to deliver. Okay, so that brings us to the final part of a solid bridge, which is the anchors. Now, really, for tools like this to work well, we need to be looking at how we can embed them into healthcare services because, tools that rely on someone just using it on their own really don't meet the needs of a lot of people. That's really going to hit people who are, more motivated, have better resources. So, how do we look at taking tools and actually embedding them into the healthcare system. So I've got a final study to share with you. Now, this is a large survey that was done by Kim Zito, who's another postdoc in our group. So in this, we surveyed about 450 participants. It was a global sample, and actually most participants were from the US. And we were asking them whether they were willing to share their wearable data with their, healthcare professionals, and whether they have shared their data, and other concerns, that kind of thing. And really, the key findings were that the vast majority of wearable users are willing to share their data with healthcare professionals, yet less than half have actually done that. And we also found that around a quarter of people do have privacy concerns. Not so much that they're not willing to share, but of course there are some privacy concerns. So, there will be some obstacles to overcome in terms of, how to share data in a really, secure way. But I think, the key thing here is that it's a bit of untapped potential. Clearly people would be happy to do it. So to wrap things up, I think the evidence really shows us that digital tools do work. That evidence is overwhelming. They work, and patients really want to use them. But we haven't yet done a good job of, working in that intersection of, really harnessing the potential of digital tools for supporting physical activity for mental health. So I guess my parting comments to you would be, for those of you who are working with patients, I'd really encourage you to think about, how you might be able to incorporate digital tools into the care that you provide to your patients, because patients are keen. They're keen and willing. And to the researchers in the room, I would challenge you to look at, actually designing tools that address this need and that intersect with the healthcare system. Thank you.